Week 2, Part 2, Health Promotion and Health Education Strategies. The new focus of health promotion retains many features of prior eras. Regulation of some aspect of health via legislation, and Nebraska's LB 18 mandating meningitis vaccine. Also to focus on sanitation, immunization, focus on risk modification, recognize the effects of social condition on health, the importance of the nurse's role. Defining health promotion is done by various definitions. Health promotion efforts in the U.S. continue to focus on behavior modification and prevention of specific health conditions, also known as vertical health promotions, rather than changing broader factors that influence the health, known as horizontal health promotions. In 2003, the United States Department of Health and Human Services created Steps to a Healthier U.S. initiative. This was promoting a behavior change. The idea was to improve policy and environmental conditions to support health. This was to reduce the burden of 5 specific conditions: asthma, cancer, diabetes, heart disease and stroke, and obesity. Examples of the vertical health promotion are when we focus on personal behavior modification and try to prevent the 5 chronic conditions. Horizontal addresses the policy and environmental conditions that influence the health. For example, insurance coverage for smoking cessation and incentives for schools to include physical activity in the curricula. The system is overwhelmed by demands for cares of many chronic diseases. The system cannot continue to meet these demands. We as nurses must do something to motivate the American people to promote and protect their own health, and to change the conditions in which people live to foster better health promotion, which is an economic necessity. Look at page 260 in the highlight sections of your textbook. There are a number of models developed to guide health promotion practice. These and other models are an attempt to explain why people do or do not engage in health promoting activities. These explanations assist population health nurses to understand the motivations and factors involved in such decisions and help them to select appropriate strategies for promotion health in the community. The first model is the precaution adoption model. This describes in stages the decision to adopt or not adopt health-related behaviors. In stage 1, the person is unaware of any health-related issues and need to adopt any particular health-regulated behavior. In stage 2, the person is aware of the issue but is unengaged by it and is not considering any action. In stage 3, the person is deciding whether or not to act. Based upon the decision, stage 4 or 5 follows. In stage 4 is when they decide not to act, and then the process stops. In stage 5, they decided to act, but they may not have taken any action. Stage 6 suggests that the person's actions start to engage the behavior. Stage 7, then, the behavior becomes routine part of his or her lifestyle. People in stage 4 or 5 who are more resistant to persuasion than those in stage 3 who have not yet made a decision. A person in stage 5 who has decided to adopt behavior proceeds to stage 6 and then, hopefully, stage 7. The theories of reasoned action and planned behavior. There are 2 types of beliefs: behavioral, which reflects the person's attitude toward the expected outcomes of the behavior, or normative, related to the subjective norms influenced by others. The intention is to act based on one's perceptions of others' attitudes toward the behavior, and value is placed then on the other's judgment. Action is also influenced by perceptions of one's ability to control behavior. Behavior beliefs, normative beliefs, and control beliefs all combine to result in behavior intention, which is the precursor to actual behavior. The integrated model of behavior prediction expands on elements influencing intention and subsequent actions, including background influences. The environmental factors and the personal skills and abilities related to desired behavior also influences the performance of the behavior. The health belief model is widely used in research and program development related to health promoting behaviors. The individual perceptions of susceptibility and severity are considered, as well as modifying factors such as demographics, socio-psychologic and structural or environmental variables, perceptions of the benefits and barriers to the actions, and cues to action. The action is based on 4 premises or beliefs. One believes that one is susceptible to or at risk for a particular health problem. One believes that the health problem can have serious consequences. One believes that the problem can be prevented, and the benefits outweigh the costs or the barriers. Self-efficacy, which is one capable of the desired behavior or of achieving change. Pender's health promotion model suggests that behavior is influenced by individual characteristics and behavior-specific cognitions and affect, or emotion, that result in a commitment to action. The commitment to action results in actual behavior, but may be modified by competing demands and preferences. Individual characteristics include personal, biologic, psychological, and sociocultural factors that are relevant to the behavior involved. Prior behavior in this area is another individual characteristic that influences health-promoting behavior. Behavior-specific cognition and attitudes include the perceived benefit of and barriers to health-promoting activity, as well as one's perceived self-efficacy. Activity related to affect or feeling, states related to the behavior, to oneself, or to the situation are also important in motivating the behavior. Interpersonal and situational influences are additional factors that influence behavior. Individual characteristics and behavior-specific cognitions and affect may lead to a commitment to the health-promoting activity. Commitment includes both the intention to act and a specific plan of action. Commitment to action should lead to performance of the actual health-promoting behavior unless there is interference from competing demands and preferences. Population health nurse and health promotion have factors of influencing health promotion. Using as a model, it allows the nurse to identify factors involved in the health promotion situation and design. The use of the model allows the nurse to identify factors involved in the health promotion situation and design health promotion programs. This focuses attention on all factors that influence health promotion and leads to a more horizontal approach to the health promotion. In 2011, the Institute of Medicine's report, The Future of Nursing, Leading Change, Advancing Health, highlighted health promotion as one of the traditional and current strengths of nursing profession. Health promotion is an even more critical role for the population or community health nurse than for nurses in any other specialty area. Some research states that the population health nurse concept of health promotion is limited and primary focus is on health education. Therefore, we must consider a number of important factors that may influence the health promotion situation. There are 4 major influences on health promotion. Fatalism is the belief that one's fate is fixed and that the personal effort can do little to affect the fate. External locus of focus, or fate under the control of others, or internal locus of control, one's life and circumstances are under one's own control. First, there must be a readiness for change. This is the trans-theoretical model of change. The pre-contemplation, which means not even thinking of making a change or aware of the need for the change, or the contemplation, considering the change and plans to take action within 6 months. Preparation for the change, and then action, which engages in the new behavior. Maintenance, which is the integration of the behavior into the usual routine. This fosters health promotion behavior by determining what stage an individual or population is in. Engage in strategies to facilitate movement in the next and subsequent stages of change. Things to also consider is the level of health literacy in the United States. This affects those that have the changes in health promotion or health or illness prevention. They are assessed at several levels. 77 million people in the United States display basic or below basic levels of literacy. 90% of U.S. adults have difficulty understanding routine health information. Assessing the literacy levels of individual clients and population groups are to design health initiatives appropriate to the level of literacy exhibited. Health literacy, as you can see on this continuum, shows where and how they fall. The most vulnerable groups report poor health, no access to health or information over the internet. Education here in the middle is a level that is a factor but not a determinant. And at the high end, it's a constant but a dynamic state that may change with situations, meaning a newly diagnosed cancer patient may not learn as much about the disease process as they're still coping with the whole idea of being diagnosed with cancer. I have this link on the Canvas in week 2 module. Please go to this and look at some of these statistics from the website proliteracy.org. It has great information regarding literacy. Some examples of these statistics are 9 out of 10 Americans have low literacy. Those that have low literacy and experience difficulty on acting on health information. Those with low literacy are twice as likely to be unemployed and more likely to have poor health. Skills have a major impact on individuals' life chances. Low-skilled individuals are increasingly left behind. Countries with lower skill levels risk losing in competitiveness as world economy becomes dependent on skills. The average hourly wage workers who can make complex inferences and evaluate subtle truth claims or arguments is more than 60% higher than workers who can read short text to locate a single piece of information. 81% of clients over the age of 60 aren't able to read or even understand their prescription labels. At this point, if you haven't yet, watch the YouTube video Health Literacy, A Prescription to End Confusion. It's in this week's module. There are many things to consider: poor health status, lack of knowledge about medical conditions and care of poor conditions, lack of understanding and use of preventive services, low level of self-reported health, inadequate compliance rates with treatment, increased hospitalizations, increased healthcare costs, negative psychological effects, sense of shame in their lack of skill. And visit this website regarding America's health literacy. So your role as the population health nurse. 1, you must know your attitude about it. Influencing health promotion behaviors among individual clients and the general public. The lack of time and reliance on written materials can lead to poor care and ineffective health promotion.